Hello, and welcome to the Millennial Nutritionist podcast. I'm Isla Garcia, master's degree of nutrition science and registered dietitian, and I'm going to make weight loss realistic, sustainable, and uncomplicated for your busy lifestyle. On this podcast, me and my team of registered dietitians will decipher the latest nutrition research, dissect fad diets, and discuss social media trends for you so you can feel confident knowing what to eat to achieve your health goals. Research suggests that most weight loss programs aren't successful, but my experience has taught me that this is not because the participants aren't committed. It's because those diets are designed by non-nutrition professionals and center around severe restrictions. We are here to provide the facts about the science of weight loss so you can have the success you want and continue living your best life. Hello, future Isla coming at you to intro this interview episode with my old OB from Fort Worth, or my previous OB from Fort Worth, Dr. Carolyn Moyers. I really loved being her patient, so I just wanted to give you a resource to have an OB that would be a great person if you have anything that you feel like your current OB may not be really helping you out with as much, but also just to answer some questions that I get a lot from clients who are wanting to become healthier pre-conception or like prenatal, and then even postpartum, that go beyond my scope of practice and a little bit more in the medical world. I know as a dietitian that being healthy helps with so many things, and healthy as far as eating enough fruits and vegetables and keeping stress levels low and exercising. But when it comes to things specific to all things baby and being a mom, as far as growing the baby inside you, I don't know what I don't know. So I wanted to bring her on to talk about some things. Just a little bit about Dr. Moyers is that she is an alumna of the University of North Texas Health Science Center. She also holds a predoctoral fellowship in neuromuscular medicine, specialized in osteopathic manipulative treatment from the University of North Texas Health Science Center. So she's extremely qualified to kind of be talking about these topics. And I just feel like she's just such a passionate OBGYN, which sometimes I feel like it's kind of hard to come by. So I hope that you enjoy this interview where we talk about how to improve your health prenatal and then postpartum and what that can look like. All right, well, let's go ahead and dive into some of our questions because I think we have a lot to get to, and I want to make sure we can get to most of them during our time together. So first, to kind of start us out, I always want to have some like defining questions so we know what we're talking about, or everybody knows what we're talking about. And the first question I have for you is, for before pregnancy, does improving our health before pregnancy even help with anything like baby's outcomes, mom's outcomes, anything like that?
Sure. So if we are optimizing our health, then we're going to have better success in pregnancy in general, whether that's, fitness in the long game, whether that's managing chronic medical conditions. So if you have high blood pressure or diabetes or something like that, we obviously want that to be optimized as well to reduce risk of first trimester loss, to reduce risk of growth restricted babies or large for gestational age babies or cardiac defects or a number of things that can happen if we do have these other medical conditions, and obviously avoiding toxins and exposures like that. And we want to reduce. We don't want to be smoking cigarettes or even smoking marijuana. During that time, because that definitely can impact overall well-being.
Gotcha. Okay. Yeah. So I was going to ask, like, how so or not if you were going to say no. And it sounds like you're saying it just helps with everything. It can help with the health of the baby, the delivery process, and the mom's chronic diseases. Is that what you're saying?
Yeah, so optimizing any chronic illnesses can help to minimize any potential risk to babies. Avoiding toxins or infectious sources, etc. Environmental exposures can help to reduce risk to baby, whether that's first trimester losses, whether that's during organ development, us developing any abnormalities in the baby. So in that first and second trimester are kind of key. And then, things like cigarette smoking, whatnot, we think, oh, it's pretty benign. No, it actually leads to small for gestational age babies and to the placenta aging rather quickly, and sometimes preterm deliveries, etc.
Gotcha. Okay. And diving into that a little bit, I left this question kind of vague because I didn't know what your answer would be, but like overall, what can we do to optimize our health in pregnancy? So maybe even like, what would you even say optimizing health means? And like, is there any like top things that you recommend to optimize health?
Yeah. So, it starts with the basics as in most things, right? That our general health and well-being. So we want to make sure we're getting adequate sleep, we're drinking our water, we're eating our fruits and vegetables, we're moving our bodies, all of those things. But also taking a prenatal vitamin. If you are in the fertile window, I would just be on a prenatal vitamin, like seriously, from the time you're even thinking about it. 20s and 30s, I took prenatal vitamins in my entire 20s and 30s, regardless of whether I was trying or not trying, because, oopsies happen. And so we want to have that folic acid on board prior to getting pregnant. And so it's not, at your first prenatal visit when you're already 10 or 12 weeks that we want to start that folic acid to avoid that neural tube defect. We want to have that on board in the first place. And as we know, baby's still all of our sources. And so it's going to take all of the iron stores it needs. You're going to be anemic. And so you're going to need that iron supplement. And so those are just general health, our general health and wellness. Like I said, maximizing any chronic medical conditions, and then also maintaining a healthy weight are all going to help. Being overweight and obese can lead to other problems with baby's growth and delivery and etc.
So you just touched on this a little bit, but like overall, does losing weight help with pregnancy? And I guess it's like, is it like any weight loss, or is it if you're in a certain weight range, it helps? Can you speak to that a little bit?
Sure. So obesity, which is imperfect definition, right? Because it's defined by the BMI.
Right.
But individuals who are obese have an increased risk of miscarriage, gestational diabetes, preeclampsia, blood clots, needing induction of labor, failing getting a C-section, just the number of complications and wound infections post-operatively. And so, there definitely are complications that can occur from that. And so, yeah, I always try to help patients to optimize that. Now, one thing I will want to say is whether they're working with a health coach or a nutritionist, or they're working, going to the gym and they have a trainer, those things are wonderful. But if they're using medications to help with obesity, it is important to know that you need to be off of any GLP-1s for a period of time before ever trying to conceive.
I didn't know that I knew like they couldn't have it while pregnancy, but even like trying to conceive, there has to be like a buffer time, is what you're saying?
Yes,
Interesting.
that is what I'm saying.
Any other lifestyle changes? So you talked about the smoking, but is there anything outside of weight loss that people can do to optimize their health for pregnancy or conception?
I mean, optimizing your sleep and your nutrition are
Mm-hmm.
really key, right? If you have a thyroid disorder, you want that to be managed because that impacts baby's thyroid development, and baby's overall general health, depending on what it is. I'm not talking about like a mild hypothyroidism, but if, you have a thyroiditis or something going on more significant, it's just important to have all of those health concerns checked up on. I love when people come in for a preconception counseling visit, because it's like, oh, good, like we're here at the right time. Let's optimize our health now.
Gotcha. Okay. And is there any like labs or medical tests or anything people should take? I guess if they're again just worried that they're not the healthiest they can be to get pregnant.
So that's going to be really case specific, right? That's going to be very unique to each individual, what their health history is, you know, what are their vital signs, what's their weight, etc. So I think it's going to be really unique for each patient. In general, I'm going to want to know if they're anemic. I want to make sure kidney function and liver function look great. Sometimes when individuals come in for preconception counseling, if they have any significant family history, they may want to do some genetic testing early. If they want to find out if they're a carrier for certain things that can impact pregnancy, there definitely are different tests, but I would hesitate to give any blanket statement like everyone should be doing these tests.
Gotcha. But that's where it is most helpful to just go talk to a professional, not like a DIY situation, is what you're saying.
Yeah. You can DIY your nutrition and your water intake and your sleep and your fitness, exercising that. But when it comes to like, don't go to any lab now and get your test and think that you're all good to go, right?
Gotcha. Okay,
So
well,
it takes a little bit of guidance there. Yeah, it's in your best interest.
What about any recommendations specifically for people with PCOS who are trying to conceive and be the healthiest they can?
Yeah, so actually, on Sky Women's Health podcast just 2 weeks ago, I had this very discussion with Dr. Carolyn Moyers, who is a reproductive endocrine infertility specialist. When it comes to polycystic ovarian syndrome, where we have infrequent cycles and polycystic ovaries, elevated testosterone or androgen levels, typically we are managing PCOS, or you should be having your PCOS managed or trying to conceive. You're doing one or the other, but we're not doing anything, right? Because there are different health risks that go along with polycystic ovarian syndrome that we want to be aware of and always take into consideration, whether that is obesity, whether that is high blood pressure, whether that is diabetes, because we know we have increased risk with PCOS. And so we want to be regulating cycles, because typically what happens is we don't have that progesterone on board. And so it's more estrogen, and you have an increased risk for hyperplasia or overgrowth of the cells of the or the lining of the uterus, which can increase your risk of uterine cancer. So it's important that you're on a progesterone birth control pill, or even IUD or something to kind of protect that endometrium and or regulate cycles. And combined hormonal birth control does a wonderful job of bringing down the androgen levels and controlling acne and all of those items. But whenever you're ready to conceive, or you're thinking about conceiving, most of my patients are on a vitamin D. They're taking their prenatal vitamin, and then whether or not you're going to cycle a progesterone and have a withdrawal bleed and use a induction agent for ovulation is a whole other story, right? Now, that's a discussion that you probably need to have with your OB or with an infertility specialist. But in general, making sure that you have a proper evaluation. We know that even 5% weight loss, we see an improvement in regular ovulatory cycles. And so maintaining a healthy weight again, or losing weight, can help to kickstart cycles. I mean, I've seen this many times where patients are like, no, I can't be pregnant. I was told I could never conceive. And I'm like, but you just lost 40 pounds and now you have regular cycles. So you certainly can conceive. And so just being aware that it is a lifelong condition that we want to be cognizant of, and we don't want to ignore it over time and then just assume that we're going to be able to conceive, down the road.
Do you feel like you're tired of trying every new diet out there whenever you're ready to lose weight, but you never really find long-term success because it's either too restrictive or just not conducive to your lifestyle? Well, then let me tell you about our 3-month lifestyle reset program. This is an individualized weight loss approach where you'll be going through our proven 6-step method, and you'll be led by a registered dietitian. By becoming a client of the program, you'll be able to learn how to control your weight, increase your energy and confidence, and also improve your overall well-being. Not to be dramatic, but a lot of clients tell us that they actually change their lives by going through the program and finally find a sustainable weight loss solution when they actually haven't found that with any other program. If you are interested in becoming a client, sign up for a discovery call on our website, themillennialnutritionist.com, with me, Isla Garcia, and I'll help match you with one of our registered dietitian coaches based off of your challenges and their nutrition expertise. If you're ready to find a sustainable weight loss solution in a non-judgmental and encouraging environment, I hope you'll connect with us soon. Are there any things that people should look out for finding a provider that cares? I mean, I know you're compassionate. You used to be my OB, and I hate that I don't live there anymore. Have you? You hear from some clients that I have that they seem that they don't feel very heard by their provider for their PCOS. Like, is there anything when they're looking for somebody that they can look for that would care?
Yeah, I know it's hard. And a lot of times I think it's just misunderstanding or inadequate education on the provider's part. If you feel like you're getting dismissed, you probably are. And so you need a second opinion. And so how to find that person? Yeah, I agree. That's hard. An REI, a reproductive endocrine and fertility specialist, is going to be an expert in all things PCOS and trying to conceive. And so if you have anybody in your area, that'd be great. If you have somebody who is, they list that as their area of specialty, definitely, or their area of interest. And also then just asking around, asking your friends and colleagues, is typically, that word of mouth goes a long way in terms of finding somebody who they feel trusted with and has good bedside manner, etc. But in medicine, if we're getting dismissed, it usually is that you need a second opinion.
Gotcha. Okay, good to hear. This was an audience question. So is there anything we should look for in a prenatal vitamin specifically? Because there are like a million choices out there.
Yeah, I mean, it's overwhelming, isn't it? Even if I tell you to go get vitamin D3, most of the times patients are calling me going, I mean, which one do I get? And you don't have to take a prescription prenatal vitamin. There is nothing special about a prescription prenatal vitamin. What should we be looking for? One that you can swallow and keep down.
Okay, that's good.
Ideally one that has, all of the nutrients recommended by the American College of OBGYN. I love Baby RX has a good one that's kind of minty scented. And so it's one of those that has all the complete nutrients within just 2 capsules, and it doesn't make you gag going down. I mean, don't take prenatal vitamins on an empty stomach and take them at night, please. And having said that, I do have an affiliation with Baby RX, but I do really like the product. I don't partner with anybody that I do not trust and believe, and I haven't tried myself. Personally, I have 4 very healthy, bright kids, and I used Nature Made from Target for all my pregnancies. So what should you be looking for? Like truly one that you can hold down. And folic acid, of course, but every vitamin these days is going to have adequate folic acid. 400 micrograms is technically what is required. Most of them have 800 micrograms. You've had a neural tube defect, you need significantly higher rates, and obviously you're going to be aware of that. Your OB is going to be discussing that with you and your dosage.
Gotcha. Okay. And then last question for preconception, is there anything women can do to increase their probability of getting pregnant? So I don't know if this is basically what you've already said, but is there anything that they can do to increase that?
Yeah. So one thing I think a lot of people do is whenever they get hyper focused on achieving pregnancy, they start ruminating and making it a job. I think that the big thing is that if you're having regular ovulatory cycles, meaning your cycles are every 28 days or every 30 days, or you have them on a regular pattern, then you're ovulating. And so let her live, enjoy life, have sex regularly. Around day 14, you're going to ovulate typically, and you want to time sex around those days. If you're having sex on a cadence of every other day or so when you're trying to conceive, the likelihood is in that first year that you are going to conceive. Like almost, I think it's 80%. I actually haven't looked at those numbers in a while, but majority of couples do conceive in their first year of trying. The caveat to that would be if you have chronic medical conditions, if you're 35 or older, we're not waiting around. We're going to go see an REI. We're going to optimize health. We're going to look at what are our options. Do we need a donor egg? Do we need intrauterine insemination or IVF or something of that nature, right? But there is, a whole process to work up of infertility. But generally, in a young, healthy population, they're going to conceive in the first year. And so we're just going to be calm and carry on.
Yeah, a year is so long to wait it out and know it's normal. You do keep referring to these chronic conditions. Could you just maybe give some examples of what that would be that would make fertility more difficult? I guess you're saying are you talking about just like hypertension, or is it just like PCOS, like uterine disorders? What do you mean?
Yeah, sure. I mean, well, yeah. I mean, we haven't gotten into that, right? But if you have large uterine fibroids, that may cause an issue. Or if you've had pelvic inflammatory infection or, STDs in the past. You could have scarring to the fallopian tubes that impede, flow. And so, yeah, there's a whole host of things to consider, but I'm talking specifically about if you had diabetes, thyroid disorder, hypertension, something of that nature that's affecting the endocrine system that could be impacting your overall health and well-being or your cardiovascular health, because our blood volume doubles in pregnancy, so there's significant things to be considered. So I think that having a preconception counseling visit is really key to look at your specific health history, social history, family history, and to take all those things into account.
Gotcha. Okay. Moving on to some postpartum questions. Just because I do get clients that or email me, they're like, I just had a baby, I'm ready to lose weight. And I'm always like, I don't know if this is like the healthiest. So I didn't know if you kind of help me tackle this.
Yeah.
So, can you first, what should be mom focusing on to improve her health after birth?
Oh, okay. So I love postpartum. I mean, it's hard. It's really hard, and mamas feel lost.
Mm-hmm.
So postpartum period, what should they be doing? Surviving, right? Asking for help.
Okay.
Asking for help where you need it. And a lot of times you feel overwhelmed. Your emotions and hormones are all over the place. And so it's hard to even know what you need help with. A
Mm-hmm.
lot of times you just need a nap and the world's a better place. And so, not being afraid to ask your network, like I need somebody to unload the dishwasher. I need somebody to fold the clothes. I need somebody to hold the baby so I can take a shower. I need to nap and somebody watch the baby so that I can nap. Um, so asking for what you need,
Mm-hmm.
getting sleep, which is really hard because mamas are, I mean, they're physically, emotionally, spiritually exhausted after birthing this baby. They're so incredibly in love, and now they're kept up all night. So it can be real challenging to make sense of life. So getting the sleep you need, hydrating is really key. Getting morning sunlight,
Mm-hmm.
making sure that you're making your doctor's appointments as well as baby's doctor appointments,
Mm-hmm.
because you want to be mindful of postpartum depression, baby blues, all of those things. Um, when it comes to like restarting cycles, that's a big issue that a lot of people think about, when can you get pregnant again, etc. Kind of depends on a number of things, but it generally, if you're exclusively breastfeeding, that can lead to what we call lactational amenorrhea. So it'll serve as serve as your birth control for about 6 months. After that point, we don't reliably trust it. And so you'll need some form of birth control if you're not planning on a baby in the next month, or, of course, condoms and family planning method, whatever your choice. But, definitely something that I'd like to bring up for patients, because I don't want you finding yourself in a situation where we're having another baby within the year. And you're like, why didn't anybody talk to me about this? Because again, it's incredibly hard. But in terms of like getting back to feeling yourself, feeling at home in your body again, right? Your core is weak. Your pelvic floor has just had a little human sit on it for 10 months, and then you're going to birth it through your pelvic floor, or you're going to have a C-section and have your abdominal muscles stretched, your lumbar spine, those muscles are all stretched. Your core is weaker than ever, and then you're responsible for carrying this baby around, feeding this baby, all of the things. And so getting back to feeling yourself, you simply just start with walking.
Mm-hmm.
Walking and engaging your core. I think that every postpartum mama should go home with a tube of vaginal estrogen and a prescription for pelvic floor PT. Pelvic floor PT is amazing. It really helps you to rehab that pelvic floor. It helps with urinary incontinence, helps to decrease painful intercourse after sex, or after babies, sorry, after delivery. And so, all those things are really important that nobody really talks about.
Mm-hmm. Yeah.
Mhm.
Yeah. So I hear you kind of saying that first, like surviving, it sounds like maybe like just trying to feel better day to day, maybe like mentally is what you're saying, or asking
Mhm.
for all that help. And then when you're ready, maybe the next step is to like start to like just bring your body back through something like pelvic floor PT and things like that. Is that right?
Yeah, yeah. Pelvic floor PT is wonderful for postpartum recovery. And it's going to help you strengthen your core because it's not just the pelvic floor, right? It's our core, it's our thighs, it's our pelvic floor. And so they're going to help you to engage all of that and to kind of rehab the pelvic floor so that, the leaky urine that happens after having babies and all of that. So they'll help you to rehab. And then in terms of returning to exercise, I generally say, so, whenever we're going through pregnancy, we typically, where we end is a little less intense than what we started, right? So like say, you run half marathons and you weight lift, right? Well, you're not going to be doing that when you're 38 weeks pregnant, right? You're probably going to be walking and doing some yoga. And so we start back where we ended, in my opinion. Right. So walking is something that is incredibly easy, that is safe, it's easy on your joints. You can always start back walking as soon as you feel up and ready. And then typically for more than that, you're going to want to wait for clearance from your provider, given your particular health history, your delivery history, etc. But typically around 6 weeks is when you can start returning to more intense exercise, should I say.
Okay. Yeah. No, I was going to ask about that, about
Yeah.
when is it good to start doing these like weight loss habits that some moms are so eager to do? Like seems like day one. It's not
Yeah. So I think the first step is moving your body, right? But you have to understand that you've just gone through a major metamorphosis. And so focusing on nutrient dense foods is where it's at, not caloric restriction. Especially if you're nursing, like you need to drink, you need to hydrate, eat all your fruits and vegetables. It's really about nutrient dense food. It's the quality of food that you're eating versus quantity so much. I think if you're going to start dieting, I would wait until you're done nursing.
Oh, okay. Okay. No, that's good to know. Last question on this. Is there anything we shouldn't do, like a big no-no, if we want to lose weight postpartum? And maybe is it just like what you're saying, just try to maybe stop until you are done breastfeeding? Is there anything else?
Yeah, I mean, I wouldn't use any medications to
Mm,
assist with you losing weight in the postpartum period. And when I'm talking about, especially the first 4 months, that fourth trimester, as we call it. And honestly, I would give yourself a year to recover. I
mm,
mean, I am an OBGYN. I am a mom of four. I have done this many times over.
uh-huh.
And I can swear, even when I had my first baby in my later 20s, I was my pre-pregnancy weight at 6 weeks postpartum, but nothing was the same.
Mm,
It was a year before I felt like this is me again. A whole year. And so with each subsequent pregnancy, I felt like it took a little longer, a little bit longer.
this might be outside of your scope.
So, yeah,
I was going to say, is there
I was
anything
just going to say, be patient.
patient? Yeah. Is there anything that you or if you've even had a patient like this, or if they just like get frustrated with that whole process, that they can do to kind of like have more grace with themselves, or anything like where they can just tell themselves like it's going to be a while, it's going to be a year, I don't need to start trying to like be really rigorous with everything to lose weight in the first 2 months?
Yeah, I don't think that I've had anybody really. I mean, in the first 2 months, you're really surviving. I don't know that I've had anybody who's been that focused on it.
Oh,
You know, I touched a little bit on mental health earlier, but I think that, taking care of your mental health and counseling, cognitive behavioral therapy, journaling, and spending time with your social group or finding a little mom and me group can be really supportive. Matter of fact, most communities now have these little fitness mom groups. We have one in Fort Worth called Fit for Mom. And it's the coolest thing. You take your stroller and you go out and meet and you have a little exercise class with the kids and, hang out. And that's a great way to build community, to not feel alone in this time, to get out and get some sunshine, to boost those endorphins. But also, you're learning, how do I exercise when I've got a baby in tow? Because you don't always have childcare.
yeah. Good to know. Well, that's all the questions that I had. I think that's really helpful, good overview to answer some questions that I get from clients for sure. If somebody's just like really in love with you after listening to this episode and really wants to work with you, where can they do that, or even like connect with you?
Yeah. So on social, we're at Dr. Carolyn Moyers and Sky Women's Health. And at skywomenshealth.com is how you can find our practice. I focus a lot on, postpartum and beyond. I do a lot of midlife care these days and sex med.
Gotcha. Okay, well, awesome. Well, thank you so much for joining us today, Dr. Moyers.
Yeah, anytime.
Thank you so much for listening to the Millennial Nutritionist podcast. For daily weight loss tips and nutrition information, you can find us on Instagram at the.millennial.nutritionist and on TikTok at millennial.nutritionist. If you find this information helpful, please subscribe to the podcast and share it with a friend who needs encouragement on their health journey. See you in the next episode.